that. But again, this is no surprise. This is nothing extraordinary. What was extraordinary is actually Alaska's run for some time. As you remember, we talked earlier about us standing up our protocol since mid-January, and it was just a matter of time before Alaska, as most of the other states, and there may be 2 states left that have not yet reported a positive, but that probably will change soon as well. And so we feel good about the protocols we have in place as a result of this positive test. We will reassess our protocols. Any changes to the protocols, the press and Alaskans will be the first to know. But again, this is not a surprise. This is not unusual given what's happening with this pandemic. And so we do have our first case identified, the COVID-19 virus, coronavirus. And once again, Dr. Zink will give some detail. We also have with us from Alaska Regional Hospital, the Chief Medical Officer, Carrie Gardner. She too will be up here to be able to speak and answer any questions that you may have. But again, we just continue to work our protocols. We continue to work with the federal government, the CDC, other health professionals in this country, contact with fellow governors and governors associations to see what they're doing in their states. But once again, we're here to announce that we did get our first positive today. It was just a couple hours ago. So that's why we put together the press conference. We want Alaskans to know when something changes in this ever fluid and ever dynamic situation involving this virus. Again, no reason to panic, no reason to get upset. We're going to have more cases as time goes on. And again, I believe that Alaska is equipped, we're geared up to be able to deal with this situation. And we'll take a look at our protocols here this afternoon, this evening. And if there's going to be any changes to any of the protocols, you'll be the first to know, and we'll let you know as soon as possible. So with that, I'd like to give Dr. Zink an opportunity to come up, say a few words, and then Carrie Gardner with Alaska Regional, and then we'll take some questions.
Thank you. So I'm Dr. Ann Zink. I'm the Chief Medical Officer for the state of Alaska. This is a day that we've all been preparing for and hoping that we wouldn't see, but unfortunately we do have our first presumptive positive, as the governor mentioned. We will be sending this lab case down to the CDC for confirmation, which is our normal process. And as we talked about, we would let you know as soon as we possibly could. Our team is actively working on trying to figure out all the details regarding this case, but it's important to share with the public a couple key details. First of all, this is a foreign national individual who is transiting through Alaska. It was a good reminder on how important the systems work and how important education was. He knew about the virus that causes COVID-19. He was monitoring himself, and as soon as he developed any symptoms that could be potentially consistent with it, this individual protected themselves, called ahead, and was able to be seen and assessed. During that assessment, they went through the process of being assessed for any acute life-threatening medical emergency, was felt to be stable, was tested, the test process went through, and was tested here in the state of Alaska laboratory. When the laboratory test came back positive, this was called to us, and we've been working closely with the hospital as well as the patient to make sure that they have been safe. They were given clear instructions to self-isolate, and this patient did self-isolate in an appropriate manner the entire time, has been incredibly kind and cooperative. My heart goes out to this individual as they are suddenly here and getting this news and information far away from loved ones and family, and so we're working closely to make sure that they are supported. When I think about this from a medical standpoint and how much I worry about Alaska as a state, and when I think about virus transmission, there's always been kind of 2 categories in my mind. And one is an individual who's transiting through the state where has known travel history that we can kind of identify who is self-isolated, versus a case of community acquired where we don't know where that person came in and out of and we don't know about the community spread. This case clearly fits in that first category. This is an isolated case that we believe that we can contain, that we can do contact investigation, and does not possess the same threat or risk to Alaska as if this was a community-acquired case in a different way. I just cannot thank Alaskans enough for being prepared, for looking at social distancing, for this person being able to protect themselves, and working closely with our hospitals to be able to make sure that we are all standing up together. As the governor mentioned, we've been preparing for this day for a long time. We were hoping we would never see it, but as we are seeing it, we continue to assess the situation and adjust as we need. And with that, I'll hand it over to Dr. Gardner.
Good afternoon, and thank you. We at Alaska Regional Hospital have been working closely with both the state and the municipality of Alaska and Anchorage in order to prepare for this day and this moment. We are here today from Alaska Regional just to reassure the public that this was an exposure that took place in a very controlled fashion. So we have been preparing for this day, as both the governor and Dr. Zink have said, and we were prepared for taking care of this individual when he did come to the emergency department. So our staff received kudos for taking full precautions with the patient, donning full protective gear. We do not know of any exposures that took place as a result of this patient arriving to the emergency department. And so we just want to convey the message that we are all working together closely in the city of Anchorage and in the larger public health world of Alaska, and that the emergency departments are safe places for people to come. Then we also want to encourage folks to use the Department of Health 211 system to help determine when it's appropriate to visit the emergency department or to visit their healthcare provider. Thank you.
All right, let's go ahead and start with questions here in the room. Joe Beagle, KPU.
Yeah, I was wondering, how did this person get to Alaska? Fly, boat, drive, you know?
Flight. This patient came by flight.
Was it a commercial flight or cargo or something else?
We're working on kind of looking at all those details right now. So we, as I mentioned previously, we wanted to get this information out as quickly as possible to you. So I left my EPI team working on all the details while we came to get this information to you all. And we'll go back and we'll continue to update you as we have more information.
Okay. Sticking with the room, Liz?
Yeah, I was wondering about the testing capacity of the state. Is it still at 120 a day, and how many test kits does the state have today?
Yeah, so thank you for that question. It continues to be a flux. There are so many steps in this test process. We've already talked about the sampling process. We've talked about the testing process. There's also a component of the swabs that are needed. So we're really looking through the entire supply chain to make sure that all of those things are appropriate and making sure that they're happening. We still have the ability to test around 1,000 people in the state of Alaska. The 120 that had been quoted and mentioned and stuff before, we can change that and up-ramp that. We've changed the ways that we put the numbers on the website, and so people may have noticed that. We list how many we've tested at the state as well as how many are tested at a commercial lab site, because we're using those commercial lab sites to be able to help support what can be done at the state, and we want to make sure all the information is being shared. Those numbers are updated between 12 and 12:30 every single day, 7 days a week. The numbers that came out today, that we had 52 negatives that were tested at the state, 7 negatives that were sent at commercial labs, and we get that information back. This case is not listed on that yet, but tomorrow on the update, we will update it as we will update all the additional ones. But as I mentioned to you all before, we would get you the information about a presumptive positive prior to being updated on the website, so you would know that the information was out there.
Taylor?
Are there any more possible outstanding cases from tests that we've had out right now? Anything that you might suspect? Are there any more suspected cases?
I mean, every case is a suspected case. That's why we're testing it. And yes, there are more cases that we're testing. We're testing all day, all night. They're kind of running around the clock. So we continue to monitor this. We really are so grateful for our healthcare providers who are doing a great job in changing their practice and behavior, being able to protect themselves and other. It's interesting as a clinician to completely change the way you have to think about a disease process. I was thinking about this the other day, like what would it feel like to practice medicine and never have known that heart attacks existed? You're having to change your entire process of thinking about a new disease that you've never seen before. And so the clinicians are doing an amazing job thinking about that, putting it in, and we're grateful to see the testing capacity and capability getting up. But part of that's working with them, and I feel like we're able to support them at this time.
Morgan, Anchorage Charity?
Do you know the route that this individual took in getting here and where he has come in contact with contracted the illness?
We don't know all those details as of yet. So again, we look at that 14-day window beforehand. This is a international traveler that was traveling quite a bit internationally prior to coming in here. And as I mentioned, our EPI team is doing investigation right now to try to think about all the different places that this person may or may not have come from, but had just very recently come to Alaska, had very little exposure in Alaska, and had monitored themselves, got tested appropriately, and had been in complete isolation since that time. So this is not someone who's been wandering through the community. This is not someone who's been shopping at the mall. This is not someone who was going out to eat. This was someone who very quickly isolated themselves and identified themselves.
Okay. Let's go ahead and take a round of questions on the teleconference line. As a friendly reminder, please keep your phone on mute until I call out your name. Let's start in Southeast with Sam at the Ketchikan Daily News. Sam, did you have a question? Okay. Moving on. Becky, Associated Press.
Thank you. Becky Boyle, the Associated Press. Dr. Bruce, can you provide any other details about the individual's age at this point? And I also had a question for the governor. You mentioned that you saw the virus as a momentary glitch, and I wondered if you could put that statement into context with what we've been seeing transpire since then.
So I'll take the first question and then hand it over to the governor. This is an adult who is otherwise healthy and was in transit, was only here briefly, and then moving on. So that's the information I can share about that person.
So Becky, if you can repeat the question that was directed at myself, we couldn't really hear you. It's broken up.
Sure, Governor. Earlier this week at one of the briefings, you had mentioned that that you saw some of these issues as a momentary glitch, and you had described seeing the virus as a momentary glitch. And I wondered if you could put that statement into context with kind of where we are right now with the preparation and just where things stand.
Sure. What I was trying to say, in referring to it as a momentary glitch, is this is not the end of the world. This is a virus. Most of the people that are impacted by the virus, from what we know so far, they get cold and or flu-like symptoms, and some of those folks that fall in a category that we were describing throughout this week, they're over 60, they have underlying conditions. Often that group has more severe symptoms and it manifests itself with more severity, and many of those folks end up seeking care in the hospital. So the momentary glitch, putting that in context, is basically we believe that if we can stretch out, as the doctor described yesterday, this bell curve, this steep curve, if we could stretch it out over several months, then we will have the capacity in our hospitals to deal with it. And in several months from now, we'll look back on this as, yes, we had a coronavirus, but we were able to deal with it, and now it's kind of integrated into the fabric of our life, meaning the chances are that this disease will be around for a while, but we will have learned how to deal with it. We'll probably have medicines to deal with it here in a few months, and vaccines within a year is our understanding. So basically, it's not an issue that we believe at this stage of the game is going to be of such severity that we really have to raise a level of urgency or concern to a high degree. We're going to keep looking at our protocols. Tomorrow, again, we'll probably have a press conference. We may ramp up our protocols after discussing what we have found and what's going on in the rest of the country and the rest of the world. But basically, we believe that this is a situation that the glitch is the bubble that we want to deal with. The large amount of individuals that may become infected, we want to stretch that out over time so it's not taxing our hospitals.
Okay. Peter Siegel, Juneau Empire.
Yeah, hi. So did this individual come to Tuskegee International Airport, and are they currently still in Anchorage?
So this patient is still in Anchorage, and they did come through the airport. That's the major airport here in Anchorage, so yes.
Okay. Andrew, KTOO.
I have a question for the governor. Just there's been some discussion nationally about paid sick leave, and I was wondering if you had any thoughts on whether Alaska employers should be paying their workers if they get sick.
That's at this stage, Andrew. That's not something that we've been discussing. We're really looking at the approach from a medical perspective. I'm sure we'll be having those discussions sooner than later. But right now, we've been just looking at our protocols in terms of how to deal with the virus itself.
Okay. Let's go ahead and one more from the Southeast. Molly Barnes, did you have a question? Let's move to the Mat-Su Valley. Tim Rocky or Tim Bradner?
Tim Rocky, Mat-Su Valley from Pearson. Dr. Zink, can you define very recently when this patient came to Alaska, and what is the process for determining others that may have been affected? Do you have a grasp on how many other people may need to self-quarantine as a result of this presumptive positive?
Yeah, so I appreciate the question. So when I say recently, really within the last 48 hours, the exact timing is still being worked out. This is an international traveler who was doing international calculations on time zones when we were working through it. So we were trying to figure out the Alaska time zone when I came over here. So I can't give you an exact detail on that. They very quickly, they had actually just, had been watching themselves because they knew that they were an international traveler. And as soon as they started to develop some symptoms that were concerning, including a fever, they called and made the appropriate arrangements to get tested. We don't know exactly how many people. From what we're hearing from this patient, they did an amazing job of incredibly self-isolating. So we put out information today on the importance of self-isolating. We put out a health alert about that. Encourage everyone to take a look at this, and hearing this patient's story, they did an amazing job of self-isolating and making sure that they really were not exposing anyone else. That being said, part of our job as an epidemiology team and with our chief epidemiologist, we go through that history very carefully. So we ask everywhere they've been in the last 14 days, everyone that they've talked to, everything else that might have happened. We don't want to leave any stone unturned, and there was literally a whole team that I walked away from when I came in here who was working through that process. And if we think in any reason someone may have been exposed to this, we will be contacting that person and asking them to quarantine themselves for 14 days to really minimize the spread of the disease if there was anyone that was at risk. In the brief story, there was not any significant concern that we had that this person had exposed anyone else in the state of Alaska. They did an amazing job of just really kind of doing that social distancing.
Okay. Tim Bradner, did you have a question?
Yes, I did. Dr. Singh, could you give us a bit more detail on the 48 hours? So the person was here 48 hours. Do you know how long it was before they self-isolated themselves? And were they all in one place? I mean, did the person travel in the city and go to a hotel or to a restaurant? Do you know that yet?
So I don't have all those details as of yet. Like I said, our team is working on a lot of those details. This person went straight from the airport to be able to kind of keep themselves in one location, watch themselves during that time, and had been, as I mentioned, they're a transient person coming through here, so they were planning to transit back out quickly. And when they developed symptoms, they then called and went from there. I don't have exact details on the last 48 hours. I gave you a broader range because I would rather be more conservative than less conservative. It's somewhere less than that. But I don't have the exact timing just because I said we were doing a lot of international calculations on time right before I left here to figure out exactly when they came in, exactly where everything went. And we have an entire amazing team in our epidemiology team who's been working around the clock for days, and they are in the process of going through all those details.
So if I follow up, did the person go to a hotel from the airport, or was he at the airport all that time?
So like I said, we're working through kind of all those details. They clearly left the airport because they went to Alaska Regional Hospital, and we're trying to figure out exactly every single place that they might have been through during that time. Again, our mission is the health and well-being of all Alaskans. So that's this individual. But if we feel at any point anyone needs to be notified anywhere along that way, any location, anyone, we will notify them, and that's part of the really amazing work that we do. And if we feel like a location or details needs to be explained because that's for the health and benefit of Alaskans, we will make sure we get that information out.
Dr. Zink, if I can just drill down one more step, was this a male, and what was the age of the person?
So like I said, this is an adult that we have been following. So that's the information. Again, we don't want to...
A male?
So I did slip earlier and say male. I was trying to just say individual. Again, but I think it's really important to emphasize on this point on protecting people. I understand that you all want to know the details of this person, but again, our job is the health and well-being of all of Alaskans, but part of that is treating each other with kindness and with respect. And what we've really seen in other states is when we identify information, people can be very aggressive and people can be very fearful. And I just really want to emphasize the point that we owe it to this person to protect their interest and their identification, but we also owe it to Alaskans to make sure we're getting you all the information we can. So that's the reason I don't have all the information, because they are in the process of making sure we got all that, while I came here to share with you the information as soon as we possibly could.
Yeah, just a comment. I've asked this team that as soon as there was a positive to us know so we can let you know. This occurred maybe 2 hours ago. So we want to let Alaskans know that we have our first positive. And I will say that as other positives appear or come into play, we're not going to stand before you, and I guess you understand that we're going to say it's Bob Smith that lives at 29 whatever road. We're not going to do that. We are going to provide all of the information necessary for Alaskans to understand, but again, there's going to be a number of folks that are going to be infected by the virus. There'll probably be people in this room that'll be infected by the virus. What we want to do is just let Alaskans know, first case, second case, how many cases, are they community cases, are they individual traveler cases? We need to know that too, so we can know how to actually address this issue and how we can look at this in terms of our protocols. But again, I asked these folks, as soon as they heard there was a case, we want to let Alaskans know, and this is a mere 2 hours ago. So there are details that we're still trying to figure out, but there are details of the individual's life and their own personal data that we're not going to share with anyone, with the press. That's their decision, not ours.
And let's move up to the interior. Aaron with the Fairbanks Daily News Monitor.
Hi, thank you. I know that earlier today Anchorage had announced that schools were going to be closed next week. There's been some announcements from the university about extending spring break and putting classes online. Given that this case occurred in Anchorage, is the governor's office planning on putting out any mandates as far as further limiting public gatherings or kind of anything like that to try and mitigate this situation?
Thank you for the question. We assess our protocols every day, sometimes twice a day, sometimes 3 times a day. What we'll do is we'll have a conversation after this press conference. We'll look at our protocols again, see if any of them need adjusting, and if they do, we'll adjust them, and then we'll release that to the press and Alaskans to let them know what those adjustments would be. But right now, again, the goal of this press conference was to let you and Alaskans know as soon as we had a positive. We wanted to let you know. We want to let you know the nature, whether it was community or individual. And so now we go back, we have a discussion, we look at our protocols, see what we need to beef up. Again, there's constant information coming in from DC, from Atlanta, from other health professionals, things that are happening across this country, across the world. We incorporate that to make sure that we are ahead of this as much as possible. So we'll take a look at that, we'll adjust, and when we do, we'll let the public know, Alaskans know.
Okay.
Thank you.
Go back to the room here for a few more questions before we run out of time. Liz, did you have a question?
Yeah, a question for Dr. Zink, or I'm sorry, I didn't get your name from last week. How did this person notify the hospital that he or she was coming in, or notify authorities? How did that happen? And is this person now